Hi everyone, Nurse Jane here. Today let's talk about cancer prevention. Cancer, it's a scary word, isn't it? No one wants to hear it. Cancer is the second leading cause of death in the US and is in the top 10 leading causes of death worldwide, accounting to nearly 10 million deaths in 2020 according to World Health Organization. And the most common in 2020 were lung cancer, breast cancer, prostate cancer, colorectal cancer, skin and stomach cancer. First of all, let's define cancer. Cancer is a disease in which some of the body's cells grow uncontrollably and then spread to other parts of the body. The human body is made up of trillions of cells. Cancer can develop almost anywhere in the body. Human cells normally grow and multiply to form new cells as needed. When these cells grow old or becomes damaged, they usually die. Cancer starts when this process is disrupted and your cells continue to make new cells, and the old and abnormal ones don't die when they should. These cells can form tumors or lumps of tissue which can be cancerous or non-cancerous. Cancer cells can spread to other parts of the body through blood or lymph system. So how can we prevent cancer? Although there's no way to completely eliminate our risk for cancer due to other uncontrollable factors such as our age and genetics, there are lifestyle changes that we can make to help prevent or lower our risk for cancer. For many people, cancer can be successfully treated, especially if detected early. Number 1, avoiding tobacco. Lung cancer is the leading cause of cancer death, with most cases caused by cigarette smoking. Current smokers are about 25 times more likely to die from lung cancer compared to non-smokers. Concentrations of many cancer-causing and toxic chemicals are higher in secondhand smoke compared to the smoke inhaled by smokers. Smoking also causes various types of cancer, such as cancer of the mouth and throat, esophagus, stomach, colon, rectum, pancreas, liver, voice box or larynx, trachea, bronchus, kidney or renal, pelvis, urinary bladder, cervix, and can cause acute myeloid leukemia. Chewing tobacco also has been linked to cancer of the oral cavity and pancreas. And this is why it's very important to avoid tobacco or stop using it to help prevent cancer. If you need help quitting, ask your doctor for advice. Number 2, protect your skin. Skin cancer is the most common kind of cancer in the US. Exposure to ultraviolet rays from the sun and tanning bed appears to play a key role in developing skin cancer. Here are the things you can do to protect yourself when outdoors. You can seek shade, apply sunscreen with an SPF of at least 30, wear sun protective clothing such as a hat or sunglasses. You can also avoid midday sun from 10 a.m. to 4 p.m. when the rays are the strongest. Number 3, limit alcohol intake. Studies have shown that drinking alcohol regularly increases your risk for cancer of the mouth, throat, voice box or larynx, liver, breast, and colorectal cancer. The risk of these types of cancer increases with the amount of alcohol you drink and the length of time you have been drinking regularly. When DNA is damaged, your cells can grow uncontrollably and create a tumor. The dietary guidelines for Americans recommend that if you do drink at all, drink in moderation. That means no more than 1 drink a day for women and no more than 2 drinks a day for men. If you're not drinking, don't start. Number 4, maintaining a healthy weight and be physically active. Research has shown that being overweight or obesity increases the risk for endometrial cancer, breast cancer for postmenopausal women, and colorectal cancer, as well as many others. One of the ways being overweight increases your risk for cancer is due to the excess weight causes your body to create and circulate more estrogen and insulin, hormones that can stimulate cancer growth. Being physically active helps with weight control and helps reduce the risk for heart disease and diabetes, so get your body moving and sit less. Number 5, eating a healthy diet. Eat more fruits and vegetables and other plant-based foods such as whole grains and beans. Avoid refined sugars and fats from animal sources. Plant-based foods are rich in antioxidants, which helps boost your immune systems and fight cancer cells. It's also good to limit red and processed meats as they have been linked in increased risk for cancer, especially colorectal cancer. I have an upcoming video that talks more about this. Number 6, get vaccinated. Part of cancer prevention is also preventing viral infections, including hepatitis B and HPV. Hepatitis B can lead to liver disease or liver cancer. HPV can lead to cervical cancers and other genital cancers, as well as squamous cell cancer of the head and neck. Talk to your doctor about these vaccines. And last but not the least, screening test. Screening means checking your body for cancer before you have any symptoms. Regular screening tests may find breast, cervical, and colorectal cancers early when they may be easier to treat. Lung cancer screening is recommended for people who are at high risk. Here are the recommended screening tests. Mammograms are best way to detect breast cancer early. The U.S. Preventive Services Task Force recommends that women who are 50 to 74 years of age and are at average risk for breast cancer get a mammogram every 2 years. Women who are 40 to 49 years old should talk to their doctor or other healthcare professional about when to start and how often to get a mammogram. Women before age 50 should weigh the benefits and risks of screening tests when deciding whether to begin getting mammogram. For cervical cancer, pap tests or pap smear and HPV tests are recommended. CDC recommends pap tests to be performed beginning at age 21. For colorectal cancer, CDC recommends screening beginning at age 45. Screening tests include stool tests, flexible sigmoidoscopy, colonoscopy, and CT colonography. Make sure to discuss with your doctor when to begin screening, which test is right for you, and how often to get tested. Thank you guys for watching. I hope you find this video helpful, and if you did, please like, share, and subscribe. It will really help me make more videos like this. Also, please comment down below any other topics you would like me to cover for next time. I'll see you guys on my next video. Take care.